Before we begin, I'd like to introduce the members of the committee that are with us today. Starting on my far left, your right, is Representative Leila Staffler, the Chair for Education. Next to her is Representative Christina Sablan, the Chair for Health and Welfare. Representative Selena Babauta, the Chair for JGO. And joining me up in the dais is Representative Karina Magothnia, the Vice Chair. I am Donald Manglonia, the Chair for Ways and Means, and we have Representative Edwin Probst, Chair for Gaming, and to my far right, Representative Patrick St. Nicholas, representing Precinct 6, and Representative Richard Lizama, representing or Chair for PUTC. All right, good afternoon, members. With that, can I get a motion for the adoption of today's agenda? All right, motion was made and seconded. All in favor, say aye. All opposed, say nay. Motion carries. The agenda is hereby adopted. Before we begin, I would like to open the floor for public comments. If there's any member in the audience that wishes to make comments. There's none. We now move on to the next item, introduction. All right, the Commonwealth Healthcare Corporation was not included in the original budget submission, and we anticipate the request to be included in the revised budget submission, which we anticipate to receive by July 1st. However, CHCC did provide the legislature with what they have in regards to their budget request. In total, CHCC is requesting $116,811,509 for the upcoming fiscal year. Of this amount, $71.7 million will be allocated for personnel, $41.3 for operations, and $3.78 million for utilities. The agencies combined all other expenses comes out to a total of roughly $45.1 million. In addition, CHCC projects that they will receive $93,903,284 in total throughout 2023 fiscal year from revenue collections. CHCC also projects that this amount will derive from a total of 5 revenue funding sources within the agency. And of the projected fiscal year 2023 revenue collections, $92 million of all projected revenue collections will derive from revenue sources on Saipan, with the remaining amount provided by the agency's public health program, BEH, Medicaid from Rhoda and Tinian. Furthermore, because of the agency's 2023 projected revenue sources, this falls short of about $22.9 million, and CHCC requests that this amount be provided via local appropriation. Of this amount, $8.2 million will be used to provide funding for 166 new full-time employees that CHCC seeks to employ this upcoming fiscal year. The remaining amount of this request shall be used to cover various expenses, including the increased cost of medication for oncology patients, funding for utilities, and capital improvements. And so with that, before we proceed, I would like to recognize additional members of the committee, Representative Joel Camacho and Representative Denita Yanktamai. It is my understanding that CHCC has a presentation for the members, and so at this time, I would like to invite the member or CHCC's team up to the chamber. And with that, CEO Munya, you have the floor.
Thank you. Let me just, sorry. Just take a minute. Honorable Chair, Representative Manglonia, and members of this committee. I am Esther Lizama Munya, the Chief Executive Officer and Health Official for the CNMI. I thank you for this opportunity to discuss CHEC's budget submission for FY 2023. With me today on my right is Ms. Pearlie Santos. She is our Chief Financial Officer. And also behind me are the leadership of CHEC, and I will call on them as if there's questions that they need, you need specific answers from them. Yes, the CFO will be making a presentation on our budget needs and requests. She will be describing how health is financed and why it is critical for the CNMI government to add adequate funding for health in the CNMI. The budget approved by our Board of Trustees represent continuous improvements to our hospital and our health system. We've added a radiologist and cardiologist on board. This is on top of our only specialists in the CNMI, an oncologist, nephrologist, otolaryngologist, and orthopedic surgeon. All come with a heavy price tag, but still not near what is being offered and paid for in other U.S. hospitals. Expanding services to our health system is critical to improving the health and livelihoods of our people who live here in the CNMI. But just like any hospital, we have to spend first to get paid. We have to spend on personnel, equipment, and all support services, including nursing, maintenance, billers. That's especially difficult when CHEC never really had a true investment from the CNMI government for health. It's also difficult when you have Medicaid policies that provide high matching percentage by the local government, or that the local government consistently does not match the territorial share. It's difficult when you have policies that make it even more difficult to recruit and retain nurses, such as the Touchback regulation and lack of appropriation. It's been difficult when we have personnel experiencing burnout during the COVID response, that a decision to leave CHEC and then CNMI is easier. One of the most valuable and cost-effective ways to improve a person's health and well-being is through health promotion and disease prevention. It's also difficult to provide adequate health promotion and disease promotion when there's this myth that everything will be paid by the federal government. Even in the Infrastructure Act by the US, there is no special grant to build a new hospital or pay for treatment. We do need an upgraded hospital facility. We added more personnel from health equity grants and grants that provide emphasis on public health and mental health. We need space. We need more surgical suites, more rooms dedicated to intensive care needs. Yes, the amount we're asking for is tremendous. We base this on the community needs and the cost of healthcare. Please consider this as an investment. Think of what we can achieve for our people. Think of providing us the tools to combat health issues affecting our people and providing them much medical treatment on island. With that, we are here to answer your questions on how we can ensure a return on investment, on your investment, and improve the health of our people. Thank you.
Good afternoon. For the record, I'm Perlita Tolentino Santos, the Chief Financial Officer of the Commonwealth Healthcare Corporation. So we would like to share a brief presentation on our budget request and what we have done with what we requested in the past since 2019. So when we send out our budget request templates to all our division head, we reminded them of our mission, vision, and our core values, because everything we do have to align with what the corporation aims to do for this island, our community members. So that is our updated mission, vision, and core values that reflects what we want to do and how we want to do it. So we ask them to focus on key areas: innovative care, excellent service, and exceptional outcomes. So with that, our department had submitted their budget request, and we summarized it in our budget proposal that was submitted to the legislature. Unfortunately, we didn't have it approved in time for the governor's first approval, a submission, but we will share the full information with the office of the governor. Sorry. So in 2019, we requested for 29.8 million. We got 2.2. But during that year, we closed with 3.3 million sum in excess revenue over expenditure. It is because during that time, we had 100% matching, federal match on Medicaid. So we were fortunate that we had 100% match because of U2. U2 allowed for the CNMI to receive 100 federal match on all Medicaid payments. 2020, we requested for 50 million because we were expecting for the cliff then. We were expecting to just get about 6 million in Medicaid funding and at 55% local match, federal match only. So we requested for 50.7 million. And again, a disaster saved the Commonwealth. We were given 83% federal match because of the pandemic. So we closed this fiscal year with 7 million deficit. And in 2021, with the continuing pandemic, we still continue to receive 83% federal match. So this year our deficit was just lower down to 700,000. But we still need the cash flow from the prior year deficit. Those are money we spent on COVID activities, some of which were not yet reimbursed to us, some of which are still pending FEMA reimbursement. So going forward to 20. So here's a recap of our performance versus our budget request in the past. And here's our historical budget request versus what we got. We got a fraction of what we request. And what we are requesting is for this legislature to consider our budget request this year as an investment on healthcare, like our CEO was saying. So here's a breakdown of our 2023 appropriation, which was summarized earlier by Chair Manglonia. We are requesting for 22.9 million. And that 22.9 billion will allow us to fill vacant FTEs since 2020. CHCC have been planning for expansion, have been planning for providing better access to the CNMI, but we were not able to fill position because of competitive salaries. We are especially now with the pandemic, it created more competition for CHCC. The rates have exponentially increased for nurses and medical providers everywhere. So it's even harder for us to fill these vacant positions. So we're asking for an investment of 8 million so that we are able to hire these FTEs and keep our existing positions. And we're also continue to ask for CHCC subsidy. I believe there's a pending legislation on our ask for commercial rate. Until that is fixed, CHCC will continue to ask legislature for assistance in paying our utilities. We as a corporation who are barely making enough to sustain our operation cannot subsidize the commercial industry in the CNMI. The government rate is about 90% higher in sewer and power and water compared to commercial rate. So we continue to ask for 3.6 million to pay our power, water, and sewer until the rate disparity is corrected. And we asked about 2.5 million in increased medical supplies for our oncology. In 2019, we started with about 10 oncology patients. With the pandemic, most of the cancer patients are not able to travel and be sent off island. And it was fortunate that during that time, CHCC received a generous donation from an anonymous donor that allowed us to build our oncology capacity. However, even with a provider and equipment, the cost of pharmaceutical supplies is exponential compared to what we were spending in 2019. We spend about 150,000 a week on oncology drugs, and a significant portion of our patients are Medicaid. And understanding how Medicaid reimburses us is on CPE. And as CEO says, we only receive the federal match. We do not receive the local match. 150,000, about 40% of those goes to Medicaid patients. 150,000 a week in oncology drugs. We used to send these people off island, and the medical referral pay 100% of the fees, not the cost. We are asking for cost reimbursement. Give it to us so that we can continue to expand our oncology services. We also asked for 4.5 million in capital improvements. And we also asked for the legislature to allow us to match some federal activities that require local matching. And lastly, to subsidize underfunded and unfunded activities, such as the Tinian Health Center, Rota Health Center, and Inter-Island Medical Referrals. So why do we need appropriation? About this, this is rounded up to the nearest 10%. So about 10% of our patient base are uninsured. Another 10% underinsured. And about 40% on the Medicaid and Medicaid PE. Another 10% on Medicare. And about 30% insured. Of the uninsured, we cannot collect. Even though we try to bill, the collection return on this uninsured is almost zero, right? Because we cannot burden the community that's already sick to pay for their health care. We have sliding fee, 0% sliding fee, and all those to pay for the uninsured. And we have underinsured, for which we recover a fraction of the cost. These are the people who have who can pay a little, are on pay plan, on sliding fee. We collect a fraction of the cost we spend on them. And then we have these Medicaid patients, for which we historically receive 55% of cost. And Medicare patient, for which we receive 100% CPE, which is true up every 1 year. So we have to advance payment for Medicaid and Medicare and wait for our cost report to get the actual reimbursement to meet 100% of what we spent on the prior year. And then we have insured, about 30%, for which we make margin. And that margin is not even enough to cover all the costs we incur. That's why we are asking the legislature to continue to support CHCC and invest to fill those gaps, to make us break even, to make healthcare affordable for the CNMI. Thank you.
Thank you for your presentation. Just give us a minute while we go back to the slide on CHCC's request. I'll just start off with the utility request. You mentioned that the current ask is based on the current rate, but if the legislation passes, how much in savings would that come out to?
I don't have the exact number, but on water and sewer, that would be about 90% of our current rate, our current billing.
Where under your expenses would the medical referral fall under?
Yeah. We did not include it in this current request because although the CEO was given expenditure authority by Public Law 22-8, there's no current legislation that allows us to administer. She has a spending authority and administration over funds for under Public Law 22-08. So we're waiting for legislation so that we could properly administer the program and therefore request proper budget for it.
No, the additional 8 million was to fund new FTs, is that correct?
Yes, new FTEs that we have established since 2020.
Since 2020. And what's the current FTE right now for CHCC?
Field under general fund is 738,000. Sorry, 738 FTEs. It's on page 6 of our budget request, the file.
Okay, thank you. At this time, I open the floor to the members. Recognize Rep. Sablon.
Thank you, Mr. Chairman, and welcome CEO and CFO and to the whole CHC family. Thank you for being here. I wanted to clarify the what you said earlier, Ms. Purley, about the commercial rate legislation. That it's still not clear to me. If this legislation passes, then CHC will not need the subsidy. Okay, so what you're currently paying now, or what you're currently paying now at the government rate is about $3.6 million over what you would pay at the commercial rate. Is that?
Not entirely, but we would be able to afford it if it's commercial rate.
I see. Okay. And then you said, what was that? You mentioned a 90% figure with respect to the utilities that CHCC pays. Could you just clarify what that percentage represents?
About half of the power and about half of the utilities would be water and sewer. For that half, that is about 90% more than what a commercial establishment would have paid.
Oh, I see.
Yeah.
Okay.
So given that we have a hemodialysis center,
Right.
and there are private hemodialysis center, how are we comparing? Where's the parity there where a government agency have to almost subsidize water for the hotel industry, right?
Mm-hmm.
When we're paying 90% more than what a hotel industry or what the private hemodialysis would be paying.
Right. Okay. And then, do you have a similar comparison for power?
Power is about only 10% more for government rate than commercial rate. It is the water and sewer that is exponentially higher.
Okay. Thank you. And then I had just a few questions about the the status of the medical referral transition at this point. So as you may be aware, what the House just passed House Bill 2277 to establish the substitute version to establish a health network program in CHC, and so I think I wanted to begin first. As you know, with the current Appropriations Act, there was funding appropriated from the general fund, and then also we recognized that there were funds that were supposed to be transferred through ARPA. So what is the status of those transfers?
We received the first three. We requested for, according to the law, the full amount, right? But we were in transition. So in consideration of the amount that they're still processing payments for, we requested for 75% of the appropriation to be transferred. We received 3 million to date.
Okay. And I'm sorry, refresh our memory. How much were you expecting for the entire fiscal year?
About 12 million.
12 million from ARPA funds.
ARPA, yes.
Okay. And you've received 3.
Yes.
Okay. And so you may also be aware that Public Law 2208 also mandates actually that there would be an advance allotment to CHCC. So those advances haven't actually happened then. And when was the last allotment that you received? Oh. Okay. Could you just give us some idea of how that has impacted CHC operations?
So really it does put us in a position where we have to be mindful, going back to the regulations, how it specifically states that insurance has to be utilized first. So we are enforcing that. Trying to see what expenditures that have been made in the past several years and see how we can cut some of those expenditures. And really just try to manage it with the amount of money that we received. And, we continue to pay, for example, housing allowances for the ones in Hawaii, because we are doing, we did a study for their positions. But it was very pending that study, finalization. We wanted to make sure that also they're not burdened to do their job, right? So we wanted to continue that operation. How it impacts is obviously, even to try to arrange for an air ambulance, for example, costs them almost maybe 300,000. So imagine if that happens, then we are using that funding specifically for that. So we try, we, in regards to how the operations work, is we're trying to finalize the policies and procedures to ensure that we address the auditors, public auditors' findings. Some of that requires that we do our due diligence to ensure that when we're spending because there's no other way to get the treatment for this patient, and that and we're managing it to the best as we can with what we're given. So it is, but nevertheless, I don't think it has impacted in a way that has decreased the quality of the services. In fact, I think it actually increased the quality because of or at least the operations, I think is makes more sense on what we're doing, because we are making sure that we're not spending for things that we shouldn't be spending. I mentioned, I think in one of our past hearings, that we've been blocking a lot of rooms, and yet these rooms have been vacant. We're using, checking on the utilization of these rooms, and also making sure that we have a good relationship with the hotels that we're blocking the rooms with, making sure they understand too that we're paying a lot of money, and we want to make sure that quality is there for our people. So I think it's in a way, it gives us, I think it's better managed, if I have to say. That I think that, because of that, of the way that we're operating it. But our worry right now is that we've already expended the 3 million.
Yeah.
And we haven't gotten the next 3 million.
And have you, and of the 3 million that you've received, that's entirely just ARPA money?
Yes,
So
only
you
ARPA.
haven't received any funds that we appropriated from the general fund?
No, we haven't.
And what about what was appropriated from SNILD?
What was appropriated where?
From SNILD?
SNILD, no, not yet.
You haven't received
No,
that
we
yet
have
either.
not received that.
And have you received any communication from finance about what the reason is for the delay or the failure to make these advances, which is mandated by the Appropriations Act?
What was the?
No, we send letter of request, and we continue to follow up.
It's an informal request. I mean, we basically send messages and say, hey, we need this payment here. And we've talked about getting a more formal request and say, hey, time's up, give us the money.
Right, because it's June and you haven't received
Yeah.
anything since January.
Yeah.
And services are continuing to be provided, right?
That's
Okay.
true. Yeah.
And just a couple more questions kind of along these lines. I wanted to also ask about another aspect of the Appropriations Act was that CHCC and yourself, CEO, would be the expenditure authority for medical referral, administration, and operations. And it has come to our attention that there have been certain contracts, like legacy contracts from the previous medical referral program, that were extended or renewed without your authorization. Could you also give us a status of those contracts, and what is the funding source for that? Is that affecting CHCC operations at all?
I am aware of one contract, but it's particularly only on the rate. I don't believe there was expenditure on it, but it was just a contract about the rate, and that was signed after Public Law 2208.
And this is a contract for what service?
It's for town place suites in San Diego.
And so who signed off on that if it wasn't you?
It was the Secretary of Finance.
Okay. So will that contract continue then even into fiscal year 2023?
The rate is, again, it's just a rate, so I believe it's still effective. Yes.
Okay, so just that one contract.
That's the only one I'm aware of.
Okay. I yield for now, Mr. Chairman. Thank you.
Thank you, Rep. Sablan. Any other members? I recognize Rep. Staffler.
Thank you, Chairman, and welcome CEO and the team of CHCC. Just to follow up on what Rep. Sablan was questioning, I was curious, did the rate go up or down?
Which one?
The rate that you were just sharing.
Oh,
Like, is it beneficially going down or did it go up?
I believe it was a contract to secure a rate.
Okay.
So it was. I don't know. I didn't see the previous contract to determine whether or not it went up or down.
So it just locked the rate in.
Yeah.
Okay. Thank you for all of the amazing updates, especially with the expansion of the services that the hospital has been providing. In particular with oncology, I was curious how many patients are served now, because you mentioned how many were before, and then with the pandemic, how has your numbers changed since people couldn't leave?
I was asking that from our medical revenue director, but it's close to 100 from 10.
Wow. So that's a lot of people who are not leaving their families and going off island and it's spending more money on the treatment because they're home and receiving it here.
Yes, and because of our screening services that we provide for oncology also, we are seeing, more in an earlier stage so that they can actually be treated.
Oh, wonderful. Okay. I wanted to ask about Tinian and Rhoda in particular. I know that there are some, there's of course the Tinian Health Center and the Rhoda Health Center, and then I know that there are at least one other clinic on Tinian. Is there another secondary clinic in Rhoda that CHCC also collaborates with?
The only No, not in Rhoda. I mean, there is a clinic in Rhoda, but I'm not sure exactly. We don't have collaboration with anyone
Okay.
there,
And not on Tinian either.
not on Tinian.
Okay. So, okay. I will yield for now, Chairman. Thank you.
Thank you. Can you just elaborate on the capital improvement projects that you're proposing for all three Centauri districts?
Those are the summation of all the requests from the detailed budget from each of the department, from equipment to furnitures and fixtures to room renovations. It's a variety of small improvements, not really a big improvement. We are hoping to get a different funding source for big hospital improvements. These are just to maintain and replace equipments that are towards the end of service life.
Thank you for clarifying. Any other member? Could we get a status on, so based on last fiscal year or the current Public Law 22-8, there were two projects identified, the MRI and the mobile X-ray container unit. Do you know anything about that or the status of those?
There is no status. I mean, status is there's nothing. We have not received anything yet.
No bids, no nothing. That's
yeah, we-
13 million.
We need the funding before we put out the bid, and we have not received any funding.
Okay. Thank you for clarifying. We do have the Secretary of Finance coming in next week. We've made several attempts to meet with him, but he was off island. So hopefully, come next week, we'll have answers for you as well. Any other members? Recognize Rep. Sablan.
Thank you, Mr. Chairman. So I understand you said that you haven't received the 1 million SNALD appropriation that we approved a couple months ago now for CHC, and that was for renovations, right? And so, and for, of course, for the 3rd Senatorial District, but it looks like the bulk of the renovations that you're proposing for fiscal year 2023 would come primarily from Saipan. So, did the renovations that you would have used that SNALD funding for, are those included in your budget request?
No, these are, the rooms are not there, are they? No, the rooms are not there on the, so when we were talking about the SNILD funding, that was focusing on upgrading some of the rooms.
Oh, so that's separate from
That's separate,
this. Okay.
yes.
All right. Thank you for clarifying that.
Thank you, Rep. Salon. Any other members? I recognize Rep. Pavalta.
Thank you, Mr. Chairman, and welcome. You said you currently have 730 some FTEs. Is that correct? On board?
Local, under the local budget.
Okay. So what other FTEs do you have? Federal grants, maybe? Can you elaborate on that? How many, and where exactly? What kind of positions?
Approximately 200 in federal funds from population health to a variety of community. We received several HHS funding, which allows for which requires FTEs. So it varies from community caseworkers to administrative officers in various population health, behavioral health, environmental health programs.
Okay. And then ARPA funds, how many have you hired?
The ARPA funds that we received were appropriated for some equipment. We actually upgraded our OR equipment. We purchased new toys for our cardiologists. So so our ARPA money, the 10 million that we are expected to receive, for of which we received already 6 million of that, we use that to do some differentials on existing employees, and buy some equipments and do some renovations all over the hospital. Some of our renovations federal funded, some require a little local match. So of that local appropriation from 22-08, we are earmarking that for local payroll, and
So no new FTEs from our.
no
is
new
what I'm-
FTEs from ARPA, unless the ARPA is HHS ARPA for community caseworker. We do have some ARPA funding, but not from the local government. ARPA funding direct from federal.
Yes, the
Yes.
subsidies. How much would it cost? How much does it cost to run our lone hospital here in Saipan per annum, considering everything? You asked for a budget of 117 million, right? For FY 2023. We only have about 75 million to appropriate out of the projected revenue that the Department of Finance has given us. How much does it cost to run our CHCC per year, considering everything? I mean, with basic, we're not talking fancy services, we're not talking fancy doctors. What it currently, the state it is in now, how much does it cost to run our CHCC?
So I don't have to open my. So this one. This shows the orange are our actual expenditure
Okay,
for 2019, 20, and 21.
okay. What is the significant increase or decrease? I see a decrease there. Oh, it's the
Increase.
appropriations.
So-
Yeah.
Yeah.
And we know the cost of getting a healthier community rises every single year. It's never going to go down because of technology that we need to address chronic diseases or whatever. Is there a specific, let's say, ratio of increase year to year or approximately?
As our population age and as NCDBs continue to increase, it becomes harder for us to determine
To
the cost of care. So we have to, the community as a whole, have to address the social determinants of health.
sure.
It's not only us. We should, the community should, at the end of the seminar says, we have to convert illness to wellness. Just changing I into we. Even illness becomes wellness. So our ask is just for the hospital
It
to
makes sense.
address the
Sure.
sickness, but there's other areas in the community that
I
has to be
agree.
addressed.
Okay. I yield for now, Mr. Chairman.
Can I add on to her statement? Just
Sure.
she brought up the social determinants of health. Even during the U2 response, during Typhoon U2, and also again during the COVID, we are seeing more people experiencing homelessness, and we have individuals, for example, that are usually healthy and then all of a sudden gets admitted at CHEC. They may have had a stroke or a heart attack and needs caretakers. Sometimes finding caretakers for them is difficult, that they basically stay longer at our hospital and are occupying beds because there's nowhere else to put them. Just wanted to emphasize that.
Thank you. Sorry, before I get to you, Rep. Probst, Rep. Karina.
Thank you, Chair, and welcome again, CEO Munya and the rest of the team. Just a follow-up question, Pearlie, on the estimated 200 FTEs funded by federal grants. Are any of those grants coming up due anytime soon? And if so, how many FTEs will be affected, and what kind of impact would that have on the organization?
We are actually not losing any FTEs from grants. We may be losing some of the FTEs from the temporary workers. And we had opened a lot of especially when we receive federal grants, we're giving them priority to apply for these grants that can ensure that they continue to work. But that's the only ones that is affected.
So none of the grants that you have right now are expiring anytime soon?
I don't believe so. Yeah, I don't think so.
Okay,
Yeah, they've been extended.
Okay.
Extensions.
great. One last one. I'm not familiar with the touchback regulation, and so I was curious if you could kind of elaborate on that, if you don't mind.
My HR chief come forward. There you go.
And pardon me, being new in the boat here. The touchback provisions, essentially, the USCIS is limiting or restricting. So employees who are hired, CW employees, CW1 employees who are hired after 2015 through, I believe, current, must have, if I'm reading the regulations correctly or understanding it or explaining the language, 3 consecutive terms, 3 consecutive renewal terms before they must exit the U.S. soil for a minimum of 30 days, and then they'll be able to return. So the way we've had to handle and our experience has been that there have been multiple workers on one permit, and so in doing the renewal process, we'll see a number of nurses, for example, having to exit because their petitions were all submitted at the same time. And so a lot of that will come up here in the next, during the fall, I believe in August, September, we'll see some nurses that may have to leave all at the same time, thus impacting the staffing at the hospital. So we're hoping for some support in terms of looking at how we can kind of work through that process.
For the clarification.
You're welcome. Thank you.
I recognize Rep. Brooks.
Thank you, Chairman. Thank you, CEO and CFO and your team for coming in today. I just kind of wanted to follow up again on what Chairman Donald had brought up earlier about the MRI. So just for clarification, the funding for the MRI has not come in yet, the $10 million from ARPA? Is that
That's correct. Nothing has come in.
okay? And that's what I really I know it's not for you to answer. You're waiting for the governor to answer that, but I think there has to be some pressure put on the governor to answer as to why this amount hasn't been put forward yet. It is obvious that the MRI is needed for so many reasons. My dad, had a stroke and recently passed away. But I remember the first night we were there, he had a CAT scan, and the doctor on call, very good doctor, was saying that really wish we had an MRI because we would be able to really read it and see clearly. The CAT scan is not good enough to really, and he said this is for anyone who has had a stroke, and then of course for so many other reasons the MRI is needed. We're talking about the need for health and for everything else, and I share your frustration with the fact that it's not being given. This is money, this ARPA money is money that's is already with the seat of my government. All they have to do is basically give it to you to get the equipment you need. And I swear, I just don't understand why is it taking so long. I think, you know, it's not a gift, it's a need. And this is money that was said that would be given. I just want to reiterate that I think the health committee led by Chairwoman Tina Sablon, I think we should really demand an answer from the governor as to why this money isn't coming forward and what is the delay. So it's really more of a comment than a question. I just wanted to say how frustrating it is. I also want to say that you know that it took calamities or you know things that went wrong in the world. Like, well, for us it was U2, right? So you got lucky. Wow, we got we got money. And then the pandemic. But I'm just wondering, CEO, in your opinion, if U2 never happened, if the pandemic never happened, and we were giving you this small scale budget or a fraction of what you've been asking for, what situation would CHC be in right now? Thank you.
Um, you're right. We were, it's like a blessing in disguise, right? Um, to get, you don't know how difficult it is, but I want you guys to understand it has been very, very difficult. Sometimes, when payment is supposed to come our way and we're waiting for it, we kind of sort of just looked at each other and said, let's see what we can beef up with our revenue, see what we can do to try to make things happen. I'm pretty sure you hear complaints from our staff, from our community about how come we didn't do this, how come we didn't do that. That's the result of it. I mean, that's the outcome. I mean, there's things we have to make tough decisions. CFO and I make tough decisions daily on what we can purchase and what we can't. Even in the SNIOD legislation, those things are that was listed there. Those are part of the FY22 budget, but it's not that we haven't acted on it because we don't want to, or for whatever reason. We haven't acted on it because we're looking at our cash flow. Every time we have to monitor our cash flow. We are losing our radiologists. We hired our radiologists almost $400,000 a year. We're losing him, and we're trying to get another one, and at a price tag of probably even almost close to $1 million. It's very expensive to pay for healthcare. And even the comment from our staff in medical referral, we're going to get the MRI, but maybe it's cheaper to just send people over to Guam. The cost of the services that we're paying, because we're paying only the airfare. We're not paying for the health claim. The health claim is being paid by the insurance. So it is, if we are going to be in the business of healthcare, and that's what we are in, then we need to pay for it. But the thing is that it's always been a struggle for us, because it seems like every time we need money, we have to ask for it. And I think it's, I hope to retire someday and be able to walk away. And I hope that the next person who comes in really has an easier way to manage, because it is very difficult when you don't have the money and you have to face your staff and tell them, I'm sorry, we have to wait. We have to wait until we have the cash flow. It's been hard. So, what would it be? I don't think we will have the staff that we have now. I think we have basically done more than we can to even try to improve the health environment or the working environment of our staff. We switched to a compressed schedule just so that we can help them with their, to have them have time for their families, so that they can have, better, again, have time with their families, but also be able to relax and take some wellness. So we have, done that. We talk about differential pay. We look at what we can pay legally and say, hey, this is something we can't, obviously we can't increase their salaries, but what we could do is we could pay them, especially those who participated without any complaints, day in and day out. Yes, I'll take care of this patient. No worries. You know, they go in the middle of the night. They receive my calls at 2 o'clock in the morning. Those are people that are answering. And yes, we want to be able to give that. So the differential pay was something that we felt like was needed. So we may not have these people that are working right now, providing services to our community. And that's what we're in also. We're in the business of services. It's people, not just equipment and not just, supplies. We really do need the services of our people. Thank you.
Thank you so much, CEO. I just wanted to ask, with, you just mentioned differential and other things, and we've seen a lot of ARPA money being thrown around for all kinds of things. Right now, the governor is giving amateur athlete, our athletes, which are great and everything, but awarding them with incentives for I think $5,000 if you get a gold medal and things like that for the mini games. So there's a lot of ARPA money that seems to be going around, but I just am concerned that this is not a game. This is life and death at CHC with our healthcare, and something. Although it is sure that having patients go to Guam may be cheaper. When you're in a situation of where seconds matter, minutes matter, it's life and death. That is the reason why we need the MRI. And I know you know that. I'm just supporting you on that, and I'm advocating and supporting you the need for this. That it's greater than anything that we could really think of, because it is such critical equipment, and that's just one of so many types of equipment that CHC is in need. I mean, we could have the best doctors and the best staff, but if they don't have the tools, we're going to continue to suffer. I mean, and that's, I guess, I share your frustration. I think a lot of us do. One last question: Did nurses get premium pay when premium pay was given out? I was just wondering if they were included.
So when ARPA authorized to pay up to $13 per hour, maximum of 25,000 per annum to healthcare workers, when that law was passed, we issued a memo that all CHCC employees employed March 1, 2021 would get differential. So we started from March 1 forward up to when we become green. When we had this, we were supposed to stop in October because the money that we got, the 5.2 million that we got for ARPA, was exhausted in October. All CHCC employees got 25% of their pay, not to exceed $13 per hour, and not to exceed 25,000 per annum, following the letters of the ARPA law. So everybody who works for CHCC got that from March 1, 2021 up to April 2022. We were supposed to stop in October when the money was exhausted, but we had a surge. And the CEO says it doesn't make sense to stop the premium when we have this community surge and our frontline workers are activated more than ever to address the pandemic. So we continue up to April when we turn medium, low, medium.
And so for those that participated prior to the ARPA, using our provider relief funds, we were able to pay those that were participating in the AOC, the ones that were actually in the front lines, and also part of the management and support of the AOC, which is the Agency Operations Center.
Thank you very much, Chairman. I yield. Thank you.
Thank you. Just to clarify, how much did CHCC get in premium pay or allocation?
It's 5.2, right? 5.2 million, but we spent about 8 million. 8 million.
Okay, yeah, because our fiscal analyst just pointed In one of the governor's submission, 11.2 was supposed to go to CCC. No, do you know anything about that?
No, we only got 5.2.
11.2 or 11 million is allocated for premium pay of hospital workers needed for the continuity of operations during the public health. So you have no recollection.
Yeah,
Is that
now you got me excited. I would ask for that because we spent 8 million and we got 5.2 million, and that's outside of the appropriation under 22-08.
When was that? Was it the revised submission for the last fiscal? Huh? Yeah, I think. Joe, can you see what? July 1st. This was a revised submission for the current fiscal year that we got in July 2021. One of the proposal was to provide CACC with 11 million. So if that's not what CACC received, that's something we can get clarification on. DG, can you just mark that for Department of Finance budget hearing? And then another clarification, I heard 3 million out of, you received 3 million, but then on your report is stating 6 million was received to date.
The 3 million is for the medical referral, which we account in a separate fund. The 6.8 million here is our 3/4 ARPA appropriation from the Public Law 22-08.
And just one more clarifying question, the 8 million in personnel costs is just for the 166 additional or new FTEs that you're proposing?
Yeah, those are just new FTEs from 2022, not including those that are vacated and we are intending to refill. Those
Those
the
are
vacant,
already included in the.
yeah, we've committed to fill those vacant positions that
Okay.
aren't new.
Thank you. Any other members? Recognize Rep. Sablan.
Thank you. I wanted to shift gears a little bit and ask about the federal funding that you're receiving for mental health. So I understand that CHCC and the Community Guidance Center in particular is looking to expand services, train more people, and that federal grants have been awarded to support that. Maybe you could give us an update on what that looks like, because as we all know, the pandemic and the disasters that we've experienced have taken a huge mental health toll on our community, and if there's need for local funding as well, if there's a local match requirement or anything like that, that would be helpful to know at this point too, as we're planning for 2023.
I can ask also Director Joe Villagomez to come up, but in regards to the matching, maybe CFO can talk about that, and then and then I'll have him update. Thank you.
Included in our request is about 800,000 in matching for behavioral health grants. But we also have some of our physicians and psychiatrists feel the match. So that's why we're only asking for that. But the need is actually greater than that. But we are using the locally funded effort as in kind match to lower what we really need in cash.
What you need in cash is 800,000. Okay, thank you.
Good afternoon, Chairman and Committee. My name is Joseph Kevin Villagomez. I'm the Director for the Community Guidance Center. Yeah, the bulk of the programs at the Community Guidance Center is federal fund based, and we are expanding. There are several we're awaiting now. We wrote 3 grants specifically to address prevention programs, both in the community and at the school base. So we should be hearing back from SAMHSA within the next month or so. We also submitted a grant to address medication assisted therapy, those people that are suffering from opioid dependence. And that also was submitted and should be hearing back next month. And finally, no, actually, and another grant that we are working closely with Population Health is to address the mental health needs of children. And together with the head of the Population Health, Ms. Heather Pangilinan, we are trying to get this money so that we have a better service to reach out. The school age population, majority, because of the pandemic, a lot of the young kids really are suffering from symptoms related to mental health issues, that we're going out and doing much more outreach and working with the schools and also in the community. And then finally, we have the 988 crisis counseling system that's going to kick off on July 16 nationwide. That's the reason why you now have to dial 670 plus the number, because there will be a number that's available where anybody in the community that's having behavioral health related issue, be it substance abuse, suicide ideation, or other stressful events in their life, rather than calling, they may still call 911, but 911 will divert it directly now to trained personnel that one will man the phone calls. Then we would have a team that will also go out in the community for both Rhoda, Tinian, and Saipan, that are trained mental health professionals to address the crisis. And then we are also going to have an area where more of a like a respite care during that time that they're having this crisis counseling, crisis episode, but not in the psychiatric unit. So that we're working closely with the psychiatry department and the other clinicians in the community. We just finished doing a training for our frontline people at DFEMS and DPS. We are having another training for the ER and the psychiatric services, mainly so that we are ready to kick off July 16 when the nation kicks in. And we're going to have it before the U.S. mainland because we're a day ahead.
Okay, wow, that's really exciting. Thank you for
Yes.
that update. And in terms of the FTEs that you'd have to hire, what percentage of the new FTEs that are being proposed in this budget are attributed to the mental health
It's
programs?
not that great. There are some position that we feel to address the level of efforts, with matching with the grant, if we can put them on local, mainly because they reach out to all the different programs. We can be paying certain people, certain amount percentage from each of the grant, but if they have to provide service for that particular grant when we're taking 10% or 20%. But some of these services are just specifically to address more the administrative side of things. And if we're able to do that, that's what we were proposing in the past. And we're hoping to do that. But we have backup plan if that doesn't go through, because we still need this personnel. Just the 988, we're looking to hire 5 new behavioral health specialists that we're training in. And our the conduit to get all these professionals is NMC. The rehabilitative health program really produces great kids that we take them and train them. They do their internship with us, and as soon as they're done, we process already the hiring. And right now there's 6 in the clinical side that all came from NMC. So we don't have to be going off island to look for folks that probably will not stay. These are people that are from here, and we will continue to work. We have 3 new interns starting in August. So we're going to have a pool of people that we're going to be choosing from to train.
Oh, that's wonderful. Go Proas.
Yes.
I'm sure NMC will be very pleased to hear that as
Yes.
well. Okay, so in terms of your FTEs then for mental health, you're looking at 10, maybe more for the next fiscal year, and that's already part of your
Right.
proposal. Okay, thank you. I yield, Mr. Chairman.
Thank you. I recognize Vice Chair.
Thank you, Chair. I was just curious, how much in indirect costs are charged to federal grants for fiscal year 2023? Are there any?
It's 10%, but not all of our grants allow for 10%. Some of our SAMHSA grant limits to 5%, and we cannot also charge indirect costs to our biggest grant, which is the WIC. The food cost doesn't allow for us to charge indirect cost on that. So in a year we get about 1.5 million in indirect cost, which is used to fund accounting, HR, procurement. Yeah,
Okay.
no fancy.
Okay. And how many grants were applied for new and renewed in the upcoming fiscal year?
Well, for the Community Guidance Center, like I mentioned, we have 4 grants already. 1 was approved, and 3 are pending, but we feel that we're going to get those grants because we have the personnel already to continue those services.
And I didn't get a chance. I looked through the budget request that you guys had submitted, and I didn't see if you had a reporting on there that shows how many grants you guys have and the respective amounts. And so I was wondering if the committee can request for that list if possible. Thank you.
Yeah, we will share the grant listing with the corresponding indirect costs that we're expecting to
great.
collect from them.
Thank you.
Thank you, Vice Chair. I recognize Rep. Babauta.
Thank you, Mr. Chairman. I'm glad you brought up the WIC program. I was reading the audit report, 2018 audit report. I think that's the latest, right, that OPA has done on CHCC, and there seems to be a few issues they brought up, non-compliance issues, especially I think with the WIC program has a few there. The mental health services has a few. Immunization has a few division. It seems to be spread out, and one of the things, the red lights that I picked up on was allowable costs, pertaining to these grants. Can you elaborate on those and why would they cite, well, not cite, but bring it up in their audit report as to CHCC's non-compliance with these allowable costs?
Mostly these are documentation reasons, like it's really not non-compliance, but documentation were not provided to the auditor in time for their audit.
Okay.
And knowing that this audit was done right after during the pandemic, we believe we did our best effort to provide documentation, and we just needed to close the audit so that we could move on with our other audits and concurred to accept, to agree, to disagree with the findings. And now we are addressing those findings with the federal grantors. Like in the past, we are hoping that the grantors will see that our documentation and internal control are in place, and they have historically forgiven us of the question costs that were cited by our auditor in the past. We are also willing to share a spreadsheet of prior year audit question costs that were resolved by grantor through our efforts. Our grant management's office under Mr. Vince Camacho and our finance office and procurement office have addressed most of the question costs in the past, and the grantors have agreed with CHCC and have forgiven us of those question costs. So we could share our project worksheets on that.
Thank you. I think this committee would appreciate that. It's minimal, really. In fact, there's no amounts here that's quite significant raised in the audit reports, and it seems to be not a recurring issue that I can see on the audit. It just caught me by surprise that some allowable costs were being cited and procurement issues and things like that. But I think the committee would appreciate your worksheet. And so a lot of this has been addressed already. Is that correct?
2018 audit, we are already in communication with CDC. There, when the audit is submitted to the clearinghouse, the agencies sends letter for us to address. So right now, two of the grantors, HRSA and CDC, have already reached out for us for additional documentation.
Okay. Thank you.
I recognize Rep. Lizama.
Thank you, Chairman. Welcome board from Chcc. I just have a concern and lovely question I want to ask, because just before we came in, I've received calls from patients or from families because of the service that you guys provided at the hospital. We already mentioned about all this grant that you've been getting, ARPA money that you've been getting, MRI that is important to the hospital. Do you receive calls from families and you record them and you see if they can be improved? Do you have that in your office? I'm just curious.
No, actually we do. It is, we have a grievance procedure. We also have a complaint receiving procedure. And when we receive these cases, when people call, we would like for them to use that system, because that's where we have an opportunity to improve. And we also have to, of course, listen to the other side of what was the issue that was brought up. It helps us. It's a requirement that we have for our Medicare to ensure that we have it. They can, I've never not answered a call from residents. So if people do have complaints, my number is public. So, people can get it, 670-287-5854. That's my number. People can, I've always answered them. So we try to help out as much as possible, of course. There are times when we direct them to the best person to answer them. So, but yeah, we understand. Yeah, I think I'll stop there, sir.
Was I have one more? No. I mean, if you were to improve and to eliminate or decrease the number of complaints in the hospitals, equipment-wise, service-wise, what will be your priority right now in front of this budget hearing? Let us hear from you. What will be the best thing to do to eliminate on some of this question? We mentioned about MRI. The patient that called me says that the doctor told him, if I have the equipment, I could have saved your, a child, women or men. But that is a complaint that they told me, is that the equipment. So what would be the most important to you, Chief Officer, Chief CEO, you want to hear that? You want to hear if it's an MRI or anything,
Oh, wow. Yeah. Well, if there's something that, we can improve right now, it's, again, we mentioned about the staffing, okay? It's complex. Let me just make it clear that it is very complex, right? I need to take care of my team. I need to take care of my people, my staff, in order for us to ensure that we have what the community needs as well. So it's not just getting additional staff, it's taking care of the people that you already have now. So that's very, very important for us to be able to address, whatever the issues are. I know that we need to do a lot more marketing. I think people need to understand exactly what we do and why the system, the process of delivering health services can be a little bit complicated. And, for an example would be to try to get someone out off island quickly. There's a lot of key elements in order to get things done, and that's how there's standards. There's regulations that must be followed in order for us to move forward. So if you're asking for us, what is it that we need to improve? um, I think you just need to fund it. I mean, really fund and make sure that we're able to do our job in giving us the tools to be able to do it well, and to be able to ensure that it's always available. People have access to it, and it has to be affordable. So that's why we also need to make sure that when we have the funds, we can provide services, like, for example, the oncology services that we're providing now, oncology screening. How is that something that we can provide for free to this community? Because we feel we need it to be affordable to the people so that they can access. We can need to remove all the barriers, and so that they can improve their health. If we can improve their health, and that's why I mentioned in my speech, health promotion, health prevention is key, as Director Villagomez mentioned about some of those grants that he's applying for. It's important so we can get our population really healthy, and we don't have to spend so much of the expenditure that we're making right now for treatment, for sending people off island. It comes with a high price tag because of the lack of prevention, the lack of accessing care early, so that they don't have to be in a stage 4 cancer, getting treatment. So we would like to improve our prevention services, and be able, and we're doing it on our own. We're going back to the oncology. That's a cost on us, but yet we feel it's worth the investment for our people to be healthy, so that we don't have to spend so much money to treat them or even to send them off island. So that's the improvement I would like. Give us that money so we can do better, and give us the tools to make it better for our people. Thank you. Sorry, it's a lot of work around.
It's a good one. Thank you. You're back, Chairman.
Thank you, Rep. Lizama. We'll take one more if there are any other member. And we'll close it out with Rep. Bavalta.
Thank you, Chairman, again. If we could approve your budget today, what would be, which we can't. I don't want to give you false hope. What would be the top 3 wish list that would be critical, that CHCC can't live without? It's a hard question, but I know there's more than 3.
The financial person and me would invest in something that will make money. We are now looking forward to looking at expanding OR, adding OR suites, right? But that OR suite need equipment, need doctor, need nurses, need techs, need lab. So it's not one item. One item is interrelated. But for me, as a finance person, I would invest in something that will bring back money, so we can.
Yeah. um as we all see, we again going back to you two and going back to the COVID response, we have to be ready for public health emergencies. And as much as we want to invest, like, let's say we have $10 million in the bank right now, and we can say, okay, let's do the renovation, let's use that for that particular, just to renovate the rooms. If there's a public health emergency in the next month, as we said, payment has to be made first before any reimbursement. We see that in FEMA. We have several millions of dollars that we're still expecting from FEMA. We've spent a lot of money. So it's always a challenge for us, again, to say, yes, we're gonna get this item. We got this much money, we're gonna get this item. We always have to think about, well, what do we have in the bank to make sure that we are able to address, to be able to respond, to be able to say to our staff, hey, go ahead and work overtime, because we need to respond to this emergency right now. That's always our challenge. So if, again, it's you can say in a household, living paycheck to paycheck is hard. living the way we're living is harder because we're also trying to decide. And honestly, you talk about calls. I get calls from medical providers asking me to pay for a $400,000 medication, but it's needed. So do I say no because I don't have the money? Or do I say, yes, go ahead and do it because this person will die if he doesn't get it? Those are the things that we're basically bringing up. And, you know, I know it's hard, and I'm sorry for maybe I'm going out of tangent from your questions, but those questions are good for us. If we can make a decision now, that's great. We can say, oh yeah, give me this. But we've seen it. You give us this money, but sometimes we have to step back and say, is this really what every day we say? Is this really what we need now, or can we wait? And that's been the decision making that we've been having to be making. We have to make because of the fact that there is no big pot of money somewhere. We talk about MRI money, we talk about medical referral money. It's great, it's in the budget. It's all on paper. There's nothing there that says it's actually in the bank. We would love to see that we can say, yes, we can have that cushion and we can move forward and move with some of the initiatives from mental health, from our population health, from our hospital to move and get it done. It's hard. And so we have to always save every day for a rainy day. That's basically our household at CHCC every day.
That was the first equipment. And that took 30 minutes.
Equipment,
Or OR.
personnel, personnel to,
Folks.
yes. And of course,
Personnel's
medical
always the
supplies.
biggest-
Yes.
And supplies.
Yes.
Okay. Okay.
And power, she says.
And power. Not only do you guys want to make money, right? You want to reduce that expense because it doesn't make sense to make money and you have this expense on the side that's draining all of that. So thank you. We will take that into consideration. Thank you. I yield, Mr. Chairman.
Thank you, Rep. Abalta. At this time, CEO Munya, thank you again for coming in and for answering the questions that the members have, as well as to your team. Thank you all for coming in today. If anyone in the gallery would like to share anything, I mean, feel free to come up and otherwise, okay. Well, after you leave here, please feel free to reach out to any of the members of this committee should something you'd like for the committee to deliberate on prior to the revised budget submission. It seems like there are two large agencies that weren't included in this initial submission, MVA and CHCC, and those are, MVA being one of our biggest industry, as well as CHCC, one of the agency that has always been shortchanged. And so, when we do get that revised submission come July 1st, if there are any concerns we have in regards to what the governor had proposed for CHCC, we'll bring you back, or we'll reach out to answer any of the questions that we have based on what the governor had proposed. Additionally, again, as I stated earlier, we do have a meeting with the Department of Finance next week, and you've certainly given us a couple of questions that we will need to bring to the Secretary of Finance, and we hope to get the answers for you and to assist CACC in getting those funds remitted. If there are any, in addition to this NIOT appropriation, if there are any other pending local appropriations by delegations that you have not received, please feel free to share it with the committee, and we'll also try to get some follow-up on the status of those local appropriations. Okay, at this time, members, again, thank you, CEO Munya, and thank you to your team. Thank you all for being here this afternoon. We will excuse you for now, and then again, we'll reach out after July 1st should we need additional clarification. Thank you. I will take a short recess. Up next on the agenda is announcements. I'm not going to say much other than we do have another committee meeting tomorrow with the DPS. The commissioner did receive the notice and he confirmed his attendance tomorrow at 2:30 p.m. Yes, and I know Rep. Yankton, you have something in the afternoon, no? 5 o'clock. Yes. So we have again tomorrow DPS 5 o'clock. I mean 2:30. I'm sorry. Yeah. And so we will see you tomorrow. Any other members with announcements? Announcement? Oh yes. Recognize Reverend Thomas.
Okay, sorry. Thank you, Chair. The meeting that was scheduled for, was it today, has been moved to the 7th at the Carolinian Affairs Office at 5:30. Yes, that's the one for the village delimitation. It has been moved to June 7th. Yes, we did the change. Okay, all right, thank you. Thank you.
Thank you, Reverend Thomas. Okay. That was hard. What time is that, Reverend Thomas? 5:30, June 7th. Okay, members, sorry. I'm really sorry about next week's schedule. We are trying to squeeze everything in so we can finish up on the budget hearings. We do have Monday. We do have the meeting with OPA and CPA. Monday, 1:30. It's to dispose of speaker's bill. He did give us a 2-week deadline, but because Wednesday would have been the 2 weeks, we have 2 budget hearings on that day as well as on the Tuesday. And so CPA did, or I spoke to the board member of CPA, and they'll try to make themselves available Monday afternoon. Miss Public Auditor Peter did confirm she will be here on Monday as well. And we are reaching, or I've sent we're reaching out with Secretary of Finance as well to provide oral testimonies. And so again, 1:30 on Monday, please members, if we can just get a quorum. If you're running late, let us know so we can have Jonathan schedule you or call you in via Teams to get the quorum established. Thank you. I recognize Walter.
So according to the schedule for the budget hearings, PSS would be the last government agency to be heard at 1 p.m. on Thursday, June 9th. Is that correct?
Yes.
Okay, out of the generosity of my heart, I was going to schedule a JGO meeting because I need to dispose of bills, but I will not schedule any for Friday, June 10th, to accommodate the budget budget hearings, just in case you need to reshift or reschedule any of the agencies next week. So next week, I will
Tuesday
yield
is
to
fine.
Ways and Means, huh?
No, we should be done by next week. And so the following week should be open for all committee meetings.
But just in case
Yeah.
something comes up. So
Thank you. For
I
your
will yield to Ways and
consideration.
Means. Thank you.
Recognize Rep. Staffler.
Thank you, Chairman. I want to apologize in advance to my colleagues. So I will not be on island and I won't be in a place that has internet service, but I will send you a bunch of questions for PSS that you can maybe
Ask.
share and ask among each other. I have a long list for you. And that's all. Thank you. I'm sorry I won't be joining with you. So make sure you come for quorum. Thank you.
Otherwise, we'll have to send Sarge up north to arrest you. All right. Any other announcement? Okay. If not, can I get a motion for adjournment? All right. All in favor, say aye. All opposed, say nay. Meeting is hereby adjourned at 2:46 p.m.